Adodododio MP Nilante Vanderpoy is asking authorities of the Princess Marie Louise Hospital in Accra to compile a list of their challenges for annual submission to Parliament. The hospital's magnetic resonance imaging machines and X-ray are all not functioning, a situation that's affecting healthcare delivery there. This came to light when the MP visited the hospital days after some parents confronted the staff there over the health delivery there.
A very pertinent issue that has to do with the strength of staff. If you look at the number of people they take care of, and also their special area children, they normally spend much more time on one child than they will have done with an adult. Because adult will be able to express himself or herself, but a child will not. So they sometimes spend much more time. So if they have more hands, it will make their work a bit faster. And I totally agree with the Director of Medical Services here. One other thing they also said about is about their infrastructure, how stressed the infrastructure is and the pressure on them. And also because of staffing, they even have equipment that can enhance their delivery, but they are unable to use that equipment. So I've taken this on board. I've asked the management to give me a short write-up, and based upon that, I'll make a presentation on the floor of the House to compel Parliament to get the ministry and government to give a special attention to this only children's hospital in Accra, so that they will continue to offer the very important and critical services they've been offering to the people of Ghana and to the people of Accra. From what they have said, they've just told me that their main block, which is over 92 years, the roofing is all leaking, which is affecting work in that block. As a member of Parliament, I've just decided that I want to use my share of the health insurance fund to immediately undertake the roofing, renovation of the roofing, so that they will be able to arrest this unfortunate situation that is affecting service delivery on that block.
Nilante Vanderpoy there. Well, the acting medical superintendent of the hospital, Dr. Isaac Aban, says the hospital has fixed some of the challenges that the patrons previously encountered.
I don't think it was much of a case. It's just that one patient started it all because they had waited for so long, which we are very sorry for. Okay, but we see quite a lot of patients and a lot of who are quite happy with the services we provide for them. Most of them, when they get to see the doctor, they are very happy. But it's just that when they are waiting, they are a bit impatient. But going forward, we're just hoping that if we get our staffing situation improved, some of these things will be things of the past.
We're still on health, and nurses at a Damango government hospital in the northern region laid down their tools in protest of the detention of their colleague Enes Green, who has allegedly raped an Italian patient. The Tamale District Court remanded Enes Green into police custody on Monday for allegedly raping that woman. His detention is to enable the Criminal Investigations Department of the police to conduct full-scale investigations into the case. In solidarity, Enes Green's colleagues have laid down their tools and demanded his immediate release on police inquiry bail. Martina Bugri has been following this story. She joins me on the line with some more. Hello, Martina.
Hello, good afternoon.
Are they still on strike, so to speak, or have they decided finally to come to start work?
They actually haven't gone on strike. They have only threatened to go on strike. They held a meeting for about 3 hours today on whether to go on strike or not. The local chairman of the nurses union called for a strike. He said that they should go on strike and it should be today, and said the way the strike action should be taken will be communicated to the nurses. But I spoke to the hospital administrator, Remy Neria, and he says that they have not gone on strike. They have been at post since and they are working. He says that they are also as an institution working around the clock to get the matter resolved by getting their colleagues out of cells. They are seeking for bail for him. And so he says because of the procedural incidents that might take place, it will take a while, but he believes that they'll be able to resolve the matter.
What are the authorities of the hospital saying about this matter? I mean, where do they stand on the position of the nurses who are backing their colleague?
They are in solidarity with the nurses.
I see.
They believe that they need to get their colleague out of where he is currently, so that together they can forge forward.
Is there any update on the lady at the center of the controversy?
Authorities have been tight-lipped on where she is. They currently do not even know where she is.
Okay. What about Mr. Green? I mean, apart from the bail, apart from the custody in which he's been remanded, are the officials, the police officials, they're giving us any further information?
No further information, except his colleagues who said they had visited him, and where he is, they are not happy about it because he didn't murder anybody. It is a rape case and it's bailable, so they are wondering why they are keeping him.
Martina, thank you so much for that update. Martina Bugri there coming to us all the way from the northern region with some updates on that issue. We'll still keep our eyes on it. We'll bring you more and more development as it unfolds.